Good morning, everyone. Today, we are going to discuss the topic sexual vital fluid. As we discussed in the previous few webinars, sexual vital fluid was very immensely described by our Maharishi. It is the main component which we are discussing when we are showing the origin of the biomagnetism in our Kaya Kalpa practice. I'm going to keep this full lecture completely on the medical side of the sexual vital fluid. So you will understand the anatomy, physiology, hormonal control, various stages in the development of the sperms, and ultimately you will get the full medical knowledge on sexual vital fluid. Unfortunately, since I'm going to discuss in a complete medical manner, there will be many new terminologies. I am sure for the scholars who are preparing for PhD and higher theses, these terminologies will be very useful. I'm going to share this whole recording both as a YouTube link and a separate video. I will also send the PowerPoint slides so that you can use this to revise and improve the knowledge. Lot of the things what we discussed here were not very well discussed in our Maharishi's teaching or the yoga college teaching because they are all not based on Western science. It is very important to get the complete knowledge of the Western science so that in the future when you are presenting your work on sexual vital fluid and Kaya Kalpa, you can discuss with appropriate terminologies and up-to-date knowledge. Once you complete this full video, you will be having complete knowledge of the sexual vital fluid from the medical point of view, and you don't have to use any other reference. Let's go in. The things we are going to discuss were anatomy, physiology, about sperms, how the sperm forms, what are the name for the early forms of the sperms, etc. Hormonal factors which controls the sperms, functions of the seminal vesicle. In case of the sexual vital fluid, if we are understanding as if a kind of vital fluid stored in the lower Muladhara area, it is the seminal vesicle. We need to understand the functions of the seminal vesicle in clear. And semen, which is the ejaculatory fluid coming out from a man. Let us start from the anatomy of the testes. As you see here, follow the arrows. I will try to open laser color also so that that's much more easy to follow. So this is the testes. The testes consist of 900 coiled seminiferous tubules. You can see this is one seminiferous tubule, this is one seminiferous tubule. So we are seeing the cross section of the testes and it contains 900 seminiferous tubules. So what you are seeing is like a magnified view of the seminiferous tubules. Each seminiferous tubules is 1.5 meter long. These are all the places where the sperms are formed. I'm going to discuss the cross section of the seminiferous tubules so that you will understand this much better in the next few slides. Once these seminiferous tubules forms the sperms, they empty by their individual seminiferous ducts into the epididymis. Epididymis is the structure present behind the testes, and the epididymis is approximately 6 meters long if you uncoil it. This epididymis leads to the vas deferens. So if you see the shape of the testes, which we know, it consists of 900 coiled seminiferous tubules, and they all join together to form epididymis. The first part of the epididymis is known as head of the epididymis, which is in the upper part. And then we have the body of the epididymis, and then we have the tail of the epididymis, which constitutes as the vas deferens. The testes has got testicular artery which supplies blood both to epididymis and the whole testes. The epididymis due to vas deferens, and vas deferens enlarges into a place known as ampulla before the vas deferens enters the prostate gland. I will explain that with the next picture. So we have seen the magnification of the testes, epididymis and the vas deferens. Vas deferens goes into the pelvis behind the bladder and it enters into the prostate. This area is known as ampulla of the vas deferens. Ampulla means slightly bigger. And you can see that in the same area we have the seminal vesicle also. Even though in this picture seminal vesicle is marked quite small, based upon the content storage, seminal vesicle can get bigger also. So we have two seminal vesicles for both sides. They are located on each side of the prostate. Prostate is only a single organ. And the seminal vesicle also empties into the prostatic end of the ampulla. So the ampulla has got prostatic end. And then it forms the ejaculatory duct. The ejaculatory duct opens into the urethra. So this is the urethra. So this is the bladder in which the urine stores. This is the bladder neck. And then we have the prostatic urethra. Once the prostatic urethra is completed, we have the starting of the bulbar urethra and then membranous urethra and then the penile urethra. This bulbo-membranous urethra is the one where the sphincter is working. The sphincter is the one which we are constricting during the Kayakalpa exercises. Since the muscles are here and we are constricting them, it indirectly gives enough stimulation to the prostate and the seminal vesicles also. When a man has ejaculation, what are all the constituents of it? The ejaculation contains the fluid from the vas deferens, which is directly coming from the testes. The ejaculation will have fluid from the seminal vesicle. It has secretions from the prostate, which opens by multiple prostatic ducts opening directly into the ejaculatory duct. And in the urethra, we have bulbourethral gland, which is known as Cooper's glands. So these glands also have the secretions which constitutes the ejaculate. So the ejaculation consists of from these four areas, which we will discuss much more in detail. Now we are going to discuss the physiology of how these seminiferous tubules work and how the sexual vital fluid is produced. So this is the cross section of the seminiferous tubules. So just to understand, this is the seminiferous tubules. If you take one seminiferous tubule and if you cut it, you will see like this. There is one seminiferous tubule and there is another seminiferous tubule here, another one here. There are multiple seminiferous tubules around. During the formation of an embryo, the primordial germ cells, this is another term which was used by Maharishi quite often, the primordial germ cells migrate into the testes and become immature germ cells which are known as spermatogonia. As I said, I will be giving a lot of medical terms. It is better to understand as much of terms. Maybe you can use this video YouTube link to revise again and again so that you are confident with these terms. When you are presenting your papers in a national or international forum, you should use the correct terminology. That's very important. So these spermatogonia are present here. Spermatogonia are formed from the primordial germ cells. The spermatogonia, as you can see, it forms one or two layers of the layers of the cells in the surface of the seminiferous tubule. This is one seminiferous tubule. At puberty, say 13 years for a boy, the spermatogonia began to undergo mitotic divisions. I will explain what is mitotic division and meiotic division. There are two types of divisions happening. We will discuss this in detail with a flowchart. With mitotic divisions, it will divide and proliferate. This forms the different stages of the sperms, and the final sperms are forming here. You can see the sperms with a long tail. The final sperms are forming in the lumen of the seminiferous tubules. There are various hormones which is responsible for the stimulation from the spermatogonia into the sperm. Usually this starts average at the age of 13 and continues throughout a man's age. But the function of this seminiferous tubules is decreased a lot in the older age. So a man has no specific time period like menopause for a woman. In a woman, there is a period maybe around 60 years or 55 years or 50 years. Menopause happens, after which there is no ovum. The menstrual cycle completely stops. But for a man, this sperm production continues throughout the life in theory. But in older men, more than 60 years, more than 70 years, the amount of the sperm production is very, very low. Okay, so these are all the things we need to understand. Now we understood the cross section of the spermatogonia and the seminiferous tubules. Now I'm going to take the cross section like this. Okay, so understand that we are going to see in the next slide a cross section in this area. Okay, so this is that. If you see, it's like a watermelon. So if you take this as a watermelon, I am taking a slice of the watermelon and showing you like this. So please understand that clearly. It's very important to see that there are some Leydig cells present outside the spermatogonial cells. It's very important to understand because Leydig cells are important in producing testosterone, which is the main male hormone. Now here in the cross section, you can see the various areas or stages by which a sperm is produced. The first stage of the spermatogenesis, the spermatogonia migrate among the Sertoli cells. So you are learning two different cells which are not related to direct production of the sperm, Sertoli cells and Leydig cells. Leydig cells were present outside as seen here. They produce testosterone. Sertoli cells are present within the seminiferous tubules. They are very important in producing enough nutrients for the growth of the spermatogonia to the sperm. The spermatogonia has to grow and cross the barrier of the Sertoli cell layer to become a primary spermatocyte. If you see, primary spermatocyte is much larger compared to the spermatogonia. Each primary spermatocytes in turns undergo meiotic division to form secondary spermatocyte. Now we will see what is mitotic division, what is meiotic division. So spermatogonia to primary spermatocyte is mitotic division. Mitotic division is very simple. One cell divides into two cells. Both the cells will be as same as the first cell. That is mitotic division. It comes with the letter T, mitotic division. For example, in the skin, one cell divides into two cells. Both the cells will be same as the previous skin cell. So that is mitotic. Mitotic division happens most parts in the body. But here in the primary spermatocyte, which is much larger, as you can see, when it divides into secondary spermatocyte, which is almost half of the size of the primary spermatocyte, the division happening is known as meiotic division. Meiotic is the one where a cell is divided into two cells, but the chromosomes will be only half of the primary cells. So the primary cells chromosome will be half in the secondary spermatocytes. I will discuss this further. Since the chromosomes are half, when a man's sperm combines with a woman's ovum, which also got half of the chromosome, it joins to form the primary embryos, which has got the complete pairing of the chromosomes. So this is how a man gives half of the chromosome and a woman gives half of the chromosome for the baby. So it's very important to have the half and half, which becomes the baby. Okay. So each division of this primary spermatocyte into secondary spermatocyte is by meiotic. Okay. Another few days time, this secondary spermatocyte also further divides to form spermatids. From this, the sperms grow. So this takes another few days here. During the stage from the spermatocyte to the spermatid stage, as we discussed, the 46 chromosomes will become 23. So only one half is from the father, and the oocyte provided by the mother gives the other half of the chromosome. The entire period of the growth of the sperms from spermatogonia to spermatozoa takes 74 days. So almost 2 months it takes for the sperms to form. In women, we know that during every menstrual cycle, every 28th day, they will be having one ovum which is released. Okay. So in this flow chart, you can see that the primordial germ cell, it enters the testes and stays as spermatogonia. This is the spermatogonia. And the spermatogonia remains dormant from birth to puberty, so approximately 13 years. And spermatogonia divide by this mitotic division into two cells, form the primary spermatocyte. It is mitotic. As I said, mitotic means the same cell will become two cells. The same chromosome 46 pairs will be here in 46 pairs. This primary spermatocyte undergoes a meiotic division. See the change of spelling here. It becomes secondary spermatocytes. In the meiotic division, we have 1 and 2 divisions. In meiotic division 1, the same pair is maintained. In meiotic division 2, you can see that the pair has become half. Only half of the chromosome is maintained. And they are known as spermatids. As you can see here, they are all spermatids, which is not fully developed. From the spermatids, you can see the sperm, which is nicely developing. And these spermatids grow into the mature sperm. Now we understood the anatomy and how this sexual vital fluid, the main component, the sperms are produced. Sperms are the only live things in the whole sexual vital fluid. Now let us learn the single sperm in detail. Okay, a sperm consists of head and the tail. As you can see, head is the main component, but it's quite small, and tail is the long component. When spermatids are first formed, the spermatid as such is just like any epithelioid cells. So epithelioid cells present in the skin, nail, anywhere like epithelioid cells. And then changing into this elongated spermatozoa is very important in maintaining the potency. So if you see from the epithelioid cells, we are getting these spermatid sperms which are quite differentiated. So it has head. The head contains a thin cytoplasm. If you see, the amount of cytoplasm is very, very thin, because the aim is not for the cell to further divide and grow. Cytoplasm is very important only in those aspects. The nucleus is very important in carrying the information. So that's why the nucleus material is very larger and cytoplasm is very, very thin cytoplasm. The most important thing you need to understand is in the head there is a very strong layer by name acrosome. It has got a lot of enzymes like lysozymes and proteolytic enzymes. This acrosome is important in the sperm penetrating the ovum. So if the acrosome is deficient, then you will be having sperms, but they are not good enough to penetrate the ovum, and that's where the infertility and other problems comes. And the hormones present are hyaluronidase and protease. These enzymes play important part in fertilization. And the tail contains three parts. There is a central skeleton which consists of 11 microtubules. They are called axoneme. And there is a thin membrane which covers the axoneme. And there are multiple mitochondria. You can see that. And we know that mitochondria are the powerhouse for a cell. The energy produced by mitochondria only keeps a cell working. This mitochondria present in all the cells, but since sperm needs to be traveling in the male genital tract as we discussed, and also goes into the vagina and female genital tract, it needs a lot of energy. So that's why we got so much of mitochondria which will produce enough energy for the sperms to move and mobile. This tail of the sperm makes the back and forth movement, which is known as flagellar movement, which is important for the sperms to travel. Usually the sperm travels in the speed of 1 to 4 millimeter every minute. So if you see in a slide, every minute it travels 1 to 4 millimeters. Okay. If there is a problem in producing the normal sperm, this is the normal sperm, nicely developed head with a long tail. If there is a problem, you will get various deformed sperms. These are all deformed sperms like two tails, two heads, very small ineffective sperm, tail which is coiled, not opening up, short tail, and you can see all these are all diseased sperms. So if a man who is maintaining good health, he will be having healthy sperms like that. That's why when we are reading the sperms in the slide of a man who is coming for infertility treatment, etc., we will see what is the percentage of the normal sperms. It's normal to have some abnormal sperms because not every sperm will go into the normal airway. Okay. There are some hormones which is responsible for the sperms to develop normally. So you need to understand mainly the 5 hormones. The first one is testosterone. As we discussed before, testosterone is produced by the Leydig cells which is present in the interstitium of the seminiferous tubules. So this is the seminiferous tubules. If you see in other cuts, this is seminiferous tubules. In this interstitium is the Leydig cells. The Leydig cells produce the testosterone. Testosterone is very important, as you know, that what makes a man into a man, and that is the main hormone. It is very important in the stages of the sperm formation. Luteinizing hormone. It is a hormone produced by the anterior pituitary. It stimulates the Leydig cells to produce testosterone. So luteinizing hormone is from the anterior pituitary. So that's where we are discussing the Agna chakra. So the anterior pituitary produces luteinizing hormone. Another hormone produced by the anterior pituitary is follicle stimulating hormone. This follicle stimulating hormone works on the Sertoli cells. So if you want to recollect what is Sertoli cells, we have seen that the Sertoli cells are present, which is important for the spermatid to go into sperms. So we have Sertoli cells inside the lumen, and the outside is the Leydig cells. Sertoli cells is stimulated by the follicle stimulating hormone, while the Leydig cells are stimulated by the luteinizing hormone. Both these hormones are from pituitary. So that's the main link from the Agna chakra pituitary to our testes. We all blankly say the secretions of the Agna chakra is important. We need to focus on the Agna chakra to strengthen it. That's what controls the whole body. But how it is controlling is through these 2 hormones. Luteinizing hormone, follicle stimulating hormone. Estrogens are produced from the testosterone itself by the testatory cells. If you see historically, they say Adam and Eve is the woman which is formed from one of the ribs of the man. Okay, from a man, a woman is formed. It is not just the belief in the Hindu mythology or Christian mythology or by the history. Even in the normal man who has estrogen, which is a female hormone, the estrogen is derived from the testosterone. So now you can understand that medically everything is correct. If a man is too much obese with a lot of fat, these fat areas, especially in the mid tummy area, fat is very important in converting the testosterone to estrogen. That's why people who are very fat will develop breasts. We call it as gynecomastia, which means a male having breast tissue getting developed. It is because of the estrogen. It is very commonly seen in the very obese people where the testosterone is converted into estrogen. Okay, so a woman is formed from a man. A woman hormone is formed from the man's hormone. You can correlate spiritually also. That's why I'm trying to stress on those things. So estrogens are formed by the from the testosterone by the Sertoli cells. And then we have growth hormone. Growth hormone is also from the pituitary. So you can see from the pituitary we have three main hormones. The growth hormone is very necessary for the background metabolic function and overall growth of the testes. If the growth hormone is not there, the whole testis will go shrinking. So inside the testes, Sertoli cells, Leydig cells, they are also controlled by pituitary. But overall growth of the testis itself is also controlled by the growth hormone, which is from the pituitary. So we will see them in the next few slides. Physiology of the mature sperm. How a mature sperm will work. A normal motile fertile sperm is capable of the sphagellated movement of the tail. It moves at 1 to 4 millimeter, as we said, every minute. The activity of the sperm is enhanced by the neutral or slightly alkaline medium. The ejaculation of the sperm should be alkaline. It can be mildly acidic, in which the movement is inhibited. A strong acidic medium will cause death of the sperm. So alkalinity is very important. If you see various, some of them, you may be an allopathic doctor, there is always a stress on reducing the acidity in the body and keeping the body slightly alkaline. This is the reason for it. So a sperm will work well, will move well, will function well only in the slightly alkaline medium. The activity of the sperm markedly increases with increase in the temperature. So when the man ejaculates inside the woman's uterus, the temperature will be slightly higher, and it will cause increase in the rate of metabolism. It will cause the life of the sperm to be considerably shortened if the temperature is too high. The sperm can live for many weeks inside the genital ducts of the testes. In the testes, a sperm can live for many weeks. That's why if a man ejaculates, then he will be having one set of sperms ejaculated, but the sperm produced can stay there for many weeks. But once it is ejaculated, once it is in the female tract, it can stay only for 1 or 2 days. That's why in infertile people, they need to have the sex in the appropriate 14th day, which is the midday in which the ovum is nicely developed so that the fertilization will happen. So if they have the sex, if they are able to calculate the 14th day and have sex in that 13, 14, 15 days, presence of the sperms which will stay for 1 or 2 days, so that the fertilization chances are very high. So you can use these things when your patient is coming for infertility treatment. Unfortunately, this 14th day should be 14 days before the next menstrual cycle, which we can't say when the menstrual cycle is going to happen. So that's why we calculate the 14th day approximately from the past menstrual cycle. That's why if a woman has a perfect 28-day cycle, the chances of calculation will be very successful, and chances of pregnancy is also very successful. Okay. Now we are going to discuss a little bit on the seminal vesicle. What is a seminal vesicle? I will explain again. So seminal vesicle, there are two seminal vesicles. If you follow the arrow, they present on both sides. Seminal vesicle is the storehouse of the sperms, and then they help in ejaculation. They constitute 30% of the ejaculate. Okay, 60%, 30 to 60% of the ejaculate. This seminal vesicle was mentioned in Tamil as Jeeva with Kulambu. Okay, I will try to get some Tamil words so that people can correlate. Jeeva with Kulambu. So what's happening in this seminal vesicle? Let's see. So each seminal vesicle is a tortuous bag-like structure is located with secretory epithelium. It secretes a mucoid material. Mucoid means, in Tamil, if you want to say, just like chali is a mucoid material. It contains abundance of fructose, citric acid and nutrient substances like prostaglandins and fibrinogen, which is helpful for the sperm's nutrition. But if you see fructose, citric acid, prostaglandin, fibrinogen, the citric acid makes the seminal vesicle constituent bit acidic. Okay, so as we said, we always wish the sperm to be a little bit on the alkaline side. This seminal vesicle makes it slightly acidic, but there are other mechanisms which neutralize that. In the process of emission and ejaculation during the sex, when the ejaculation happens, the seminal vesicle empties the contents into the ejaculatory duct after vas deferens empties the sperms. So during the ejaculation, what happens is, if you see in this picture, the vas deferens coming directly from the testes, it first empties here and then the seminal vesicle empties its content. Okay, so that is the order in which the ejaculation happens. And the action adds greatly to the bulk of the ejaculatory fluid. If a patient has problems in the seminal vesicle, they will have ejaculation, but the ejaculation will be very small amount. And seminal vesicle, as I said, because of the fructose, has got good nutrient values. And there are prostaglandins. There are two uses for prostaglandins. The prostaglandin makes the female cervical mucus more receptive for sperm movement. Prostaglandins makes the mucus good so that the sperms will move and help in copulation and help in the fertilization. In the female tract, if you see, the ovum produced and then stays, and then ovum needs to come out in the menstrual cycle. The seminal vesicle needs to go against the stream. So this backward reverse peristaltic is helped by the prostaglandin. So prostaglandin helps in reverse peristalsis, and also it makes the female tract nicely receptive for the sperms to join. Prostate gland. You have seen the prostate gland already. I will just take you again. So prostate gland is the one through which the everything opens and prostatic urethra, and then the ejaculation happens. This is the prostate gland. What are the functions of the prostate gland? Prostate gland also secretes a thin milky fluid which contains calcium, citrate, phosphate and clotting enzymes and fibrinolysin. During the emission, again, prostate gland also contracts simultaneously with construction of the vas deferens, and this thin milky fluid from the prostate glands add further bulk to the semen. So the milkiness of the ejaculate is due to prostate. The mucoidness is due to the seminal vesicle. So you know that sperm is milky in color and mucoid. So now you know what is the reason for which glands. The main important use of prostate is it is alkaline. It is very important for successful fertilization to ovum because we need an alkaline environment. So whatever happening, the other areas are all acidic. So prostate gland makes the ejaculate alkaline. Even the female vaginal secretions also little bit acidic, 3.5 to 4. So this alkalinity is mainly by the prostate. It increases the pH up to 6 or 6.5. Because of the slightly alkaline prostatic fluid, it neutralizes the acidity of the other seminal fluids and also the alkalinity in the female tract Alkalinity increases the motility of the sperms. I don't want to make it very complex, but if you want to understand the Jiva Vittu Kodambu and sexual vital fluid, you should understand these things. I know a lot of things you need to hear again and again so that you are very comfortable with the terminologies. Sperm is a single cell, semen is the one which is the ejaculate. So semen which is ejaculated during the male sexual act consists of fluids from vas deferens, which is 10%, seminal vesicle, which as I said is a 60%, that's the main thing, which is storage, and prostate glands, which is 30%. And also the mucous glands, especially the bulbourethral gland, also secretes mucus. So 10, 60, 30 and the mucus from the bulbourethral gland. I will take you to the picture again. It's very important to understand what is sexual vital fluid. That's the main thing we are discussing. So a sexual vital fluid which is ejaculated consists of 10% from vas deferens, which is directly coming from the testes, 60% from seminal vesicle, so 10 plus 60 is 70, 30% from the prostate, 100. So 100% we are able to know where it is coming from. But apart from this, there are some mucus secretions from the urethral gland, bulbourethral gland, which is also known as copper gland. So now you know exactly what is sexual vital fluid, what is the anatomy, and how the physiology works. The average combined semen is nicely alkaline. It is 7.5. So every constituent is very important to maintaining the alkalinity. And it neutralizes the acidity in other portions of the sperms and also in the female tract. The clotting enzyme in the prostatic fluid keeps the semen intact in a mucus form. So if a man ejaculates, if you put it in a slide and see, it forms the mucus and stays there because of the clotting enzymes present in the prostate. It's not running away like water. This coagulum, when you enter into the female tract, it dissolves in next 30 minutes, 15 to 30 minutes by fibrinolysin, which is the enzyme present which we discussed. And this dissolving of the semen is very important in releasing that millions of sperms. Sperms can live many weeks for male glands, but once it enters the female, it can stay only for 1 or 2 days, which also we have discussed very well. When needed, for example, if a man has to do some sperm test, if he's collecting the sperm in his home by masturbation, he needs to keep it warm to his body temperature. So the best advice is to keep the sperm in his shirt pocket so that it's warm with his body temperature. But if somebody wants to store the sperm, it can be stored in the low temperature for longer period. If you're storing below 100 degrees, which is the freezing of the sperms, frozen sperms, it can be preserved for years and years. For example, if a young patient, 20-year-old, not married, if he's having some testicular cancer, and we usually get some sperms to freeze it so that even the testicular cancer, sometimes he will be losing one testis, or because of the radiation or chemotherapy, the other testis work also will be quite diminished. So the stored frozen sperm can be thawed and used for further fertilization. I think this infertility, freezing, thawing of sperm, that is slightly not necessary as of now. So our aim is to understand what is sexual vital fluid, what is that Vittu Kalam, which we are saying so frequently in the Kaya Kalpa, how the Ashwini Mudra, the exercise areas are so closely related to prostate and seminal vesicle, and what are all the constituents of this seminal vesicle content and also sexual vital fluid. That's the main idea of this presentation. Now we will complete this by understanding how the hormones, the pituitary hormones, are controlling the testis secretions and other things. So as you can see, the brain has got the hypothalamus and pituitary. So this area is now magnified. You can see that hypothalamus, and from the hypothalamus, pituitary is hanging down like a cherry. Okay. And this pituitary contains two parts, anterior pituitary and posterior pituitary. Anterior pituitary is very important in our today's discussion. Anterior pituitary secretes the hormones which we discussed already, and the hormones are luteinizing hormone and follicle stimulating hormone. Luteinizing hormone helps the interstitial Leydig cells to produce testosterone. Okay, and follicular stimulating hormone stimulates the Sertoli cells, and they help for the sperms to grow from spermatogonia to mature cells. So this is how the pituitary controls everything. Okay, so pituitary is the area we are concentrating during the Agna meditation. So strengthening the pituitary is so important in controlling the testicular function in testosterone and secretions, and the semen secretion also. The testosterone helps in androgenic effects, which means that what makes the man into a man. Okay, androgenic effects. And the Sertoli cells helps in spermatogenesis, which is the sperm production. All these things indirectly inhibit the pituitary. If there are too much of testosterone, it inhibits the pituitary, so that the luteinizing hormone will come reduced, and then testosterone also reduced. So they have a nice inhibitory mechanism. So pituitary stimulates, and if it is too much, it also inhibits. So that is another important thing. How hypothalamus controls the pituitary is by gonadotropic releasing hormone, GnRH, gonadotropic releasing hormone. So this is the upper half, gonadotropic releasing hormone from hypothalamus controlling the pituitary, mainly the anterior pituitary, and anterior pituitary secretes luteinizing hormone and follicular stimulating hormone controlling the testes function. So this completes the overall picture what we need to know about sexual vital fluid, Jiva Vittu Kodabu, how the Kayakalpa works in maintaining the healthiness near the seminal vesicle, and what is the importance of the Agna Chakra and other things in the discussions what we did. I've taken all the pictures and details from a quite latest book released last year. It is known as Guyton Hall Textbook of Medical Physiology. It will be a slightly difficult book for those who are not trained allopathy doctors to read, but some of you may be very interested. The book is released last year. It is the 14th edition. When I was a student in the medical school, it had something like 10th edition or 9th edition, I think. So very good book which will tell a lot of information. You can learn much more also about the sexual vital fluid. So in summary, the main thing what we have seen is we discussed the anatomy of the testes. We have learned very clearly how the seminal vesicle, epididymis, vas and all is formed. We have discussed the main other anatomy of the prostate, seminal vesicle and the urethral gland. They form the main components of the sexual vital fluid. We discussed the Kayakalpa, means this is the muscle layer which we constrict. We discussed the cross section of the seminal vesicle which produces the spermatogonia, and it matures slowly to form the sperms, and spermatid Sertoli cells are present here, while the interstitial cells contains the Leydig cells. We discussed how a spermatogonia goes by initial mitotic division to primary spermatocyte, and primary spermatocyte becomes secondary spermatocyte by meiotic division. I discussed mitotic, meiotic. The easiest thing is mitotic, which comes with T, is normal. The cell will become 2, just the replica. Meiotic means the cell will become 2, but the chromosome is halved. It happens in the region of the secondary spermatocyte. And this flowchart told us how the primordial germ cells become spermatogonia, primary spermatocyte, and when the primary spermatocytes become secondary spermatocyte, the chromosomes are halved. So half of the chromosome is coming from the father, half is coming from the mother. We discussed the structure of the sperm in detail. We discussed what are all the hormones control the sperms, and if it's not controlling, we get all these abnormal sperms. We discussed how a mature sperm work, why alkaline and other enzymes are very important. We discussed how a seminal vesicle works and prostate gland works. And we discussed the semen, the exact constituent of semen, and what is its life in a man's body, in a woman's body. In a man's body, it can stay for many weeks, while in woman's body, it is only 1 or 2 days. We discussed the hormone control from the Agna chakra or the anterior pituitary, and how the pituitary is controlled by the hypothalamus. And I showed you the source of the book also. I hope it is very useful. I know I have introduced a lot of new terms, but if any of you are interested to know everything about sexual vital fluid, I'm going to do a good usage of these modern Western terminologies or allopathic doctors' book terminologies so that I can answer all the questions in the national or international forum. You need to understand these terms. It's very easy. Once you start learning it, once you start seeing this video again and again, you will be absolutely thorough in these terminologies. This is the allopathic side of the sexual vital fluid and Jiva with the Kodam. Thank you for hearing.